We are starting with slide number 37 of the chapter 27 part A PowerPoint slides. Okay, so we are going to cover the male reproductive system. The gonads of the male reproductive system are the testes. The testes are defined as the sperm-producing male gonads that lie within the scrotum, which is just the sac for the testes. Each, you've probably heard the term testicles, so a testicle is just a single testes. So testes is plural, testicle is singular. All right, the sperm is delivered to the body through a system of ducts, and these ducts are called the epididymis, the ductus deferens, or you may have heard it as the vas deferens. This is the structure that is cut and tied off during a vasectomy, the ejaculatory duct, and the urethra. So this is the pathway for sperm: the epididymis, the ductus deferens, the ejaculatory duct, and the urethra. The accessory sex glands, which contribute to the composition of the semen, because semen is sperm and then it's also other materials, other fluids and solutes. So the accessory sex glands are the seminal glands, the prostate gland, and the bulbourethral glands, which used to be called the Cowper's glands. But seminal glands, the prostate gland, and the bulbourethral glands. And so we will talk about the composition of semen and how each of these glands contributes to what makes up, male semen. There's a good animation on the male reproductive system that you can watch. And then this is a diagram. So let's go over the important structures. First we have, and I'll go back to pointer instead of the highlighter. Hold on. Laser pointer. Okay. So first we have, let's look at the testicle here that's being shown. So this is the testis, which is inside a sac called the scrotum. And what you're going to see is, first of all, this structure called the epididymis. So once the sperm is produced, it's going to pass through the epididymis into the ductus or vas deferens, which is this structure here, into the ampulla of the ductus or vas deferens, which is going to contract to release the semen into the ejaculatory duct during ejaculation. And then from the ejaculatory duct, semen will enter the urethra and, of course, be released from the male's body through the penis. So we have epididymis, ductus deferens, ejaculatory duct, and urethra. Okay. Let's see. And the glands that we were just talking about. Okay, so starting with the seminal gland. The seminal gland is parallel with the ampulla of the ductus deferens. The seminal gland is here, and then the prostate gland is here, kind of surrounds the vas deferens, and then it's very close to the entrance to the urethra. And then we have the bulbourethral gland here. And so all of these glands, the seminal gland, the prostate gland, and the bulbourethral gland, are going to contribute to the composition of semen, in addition to the sperm that are released. All of those components are going to contribute to the composition of semen. So scrotum and testes. The scrotum is the sac that is outside the body of the male. The reason it's outside is that keeps the temperature inside the testes 3 degrees lower than the core body temperature. And that lower temperature is necessary for sperm production. Now, there are two muscles associated with the testes. They are called the dartos muscle and the cremaster muscle. So the dartos muscle is a layer of smooth muscle that wrinkles the skin of the testes when the testes are cold, like if the man goes swimming in cold water or if it's just cold outside. The cremaster muscles are skeletal muscle that will elevate the testes when it's cold. Both of these muscles, their purpose is to keep the core temperature low in the testes. Okay. We're going to move past that. You do need to know about the seminiferous tubules. Those are they were found within the testes, and that is where sperm are produced in a process we call spermatogenesis. So the seminiferous tubules in the testes are where sperm are produced. And then sperm leave the seminiferous tubules and they enter the straight tubules, the rete testis, the efferent ductules, and the epididymis. And that is the pathway that sperm will take. So let's look at those structures. All right, so this is your testis, and this is your epididymis. In the testes, these tubules that are folded all up, they're called they're yellow. They are called the seminiferous tubules. Sperm are produced here, and then they're going to enter the straight tubules, which connect to the rete testis, which connect to the efferent ductules, and then the epididymis. All right, so we'll go back to that path. From the seminiferous tubules, sperm are going to enter the straight tubules, which connect to the rete testis, and then they're going to enter into the efferent ductules, which connect to the epididymis. And then, of course, from the epididymis, the sperm are going to be, during ejaculation, they're going to travel from the epididymis through the ductus deferens, through the ejaculatory duct, and then the urethra. In the clinical note, the homeostatic imbalance 27.1 is the note about testicular cancer, which is rare, but it's the most common cancer in men from ages 15 to 35. A risk factor could be having mumps that lead to orchitis, inflammation of the testis. And the most common risk factor, it actually occurs in small male children. Cryptorchidism is the most, cryptorchidism, I'm sorry. It's very easy to mispronounce that word, but it's cryptorchidism, the most common risk factor, and it just means that the testes have failed to descend, non-descent of the testes. They're supposed to descend early in development after the child is born. I think they're like toddler age, but if they don't descend, that can cause the male to be sterile, and it could lead to risk of testicular cancer. The sign of testicular cancer is a painless, solid mass in the testis. And 90% of testicular cancer is cured by surgical removal of the testis and radiation and chemo. The male duct system, we already have gone over this, but the epididymis, the ductus deferens, the ejaculatory duct, and the urethra is the pathway that sperm will take during ejaculation. A vasectomy is the cutting and tying off or ligating of the ductus deferens. It is almost 100% effective form of birth control. So it's a wonderful option for couples, you know, personal choice and all that, but it's a really good option for married couples who've had all the children that they, you know, would like to have. We have already looked at that picture. So the urethra itself has, well, first of all, and I know that you guys know this, but let's make sure. Sometimes I'll get a student that has a misconception about this. So you should understand the male urethra is different from the female urethra, because not only does urine pass through as it exits the body, but semen. Okay, so the male urethra conveys both urine and semen, of course, at different times. There are 3 regions of the male urethra. There's the region that's surrounded by the prostate gland. It's called the prostatic urethra. That's like the beginning portion of the urethra. Then there's the membranous urethra, and then there is the spongy urethra. So the membranous and the spongy. So it goes prostatic, membranous, and spongy. And you can see the different portions here. Here's your prostate gland. So this is the prostatic urethra. And then you have the membranous urethra, which comes next. And then you have the spongy urethra, which comes after that. I'm looking for where it is labeled. The membranous urethra is this part right here that's labeled as the intermediate part of the urethra. And then, here we go, the spongy urethra. And then this is the external urethral orifice where the urine and semen both leave. Okay, the penis itself is the male copulatory organ. In other words, it is used for sexual intercourse. The external genitalia are both the scrotum and the penis. The penis consists of the root and the shaft, and then the end of it is called the glans penis. The foreskin, if the male has a foreskin, is called the prepuce, which is a cuff of loose skin that covers the glans penis. So some men do not have that because they have been circumcised. So circumcision is the surgical removal of foreskin. About 60% of males in the United States are circumcised, but only 15% in other parts of the world. Studies show there's a 60% reduction in HIV risk and reduced risk for other reproductive infections when the male is circumcised. Then there is a lot of argument about that. So I don't even really want to teach about it because honestly, this is there's a whole lot of disagreement on whether or not men should be circumcised, and I'm not sure how I feel about it. So you can Google it and get more information if you would like. But most of the time in the United States, little baby boys are circumcised, when they are born. But it is a decision that the parents can make, that the mother can make. Can choose to not do the circumcision. Okay, there's tissue called the corpus spongiosum and the corpora cavernosa. The corpora cavernosa are paired dorsal erectile bodies, and the corpus spongiosum expands to form the glands and the bulb of the penis. These are just structures of the penis, and I'm just sitting here thinking, which ones did I ask questions about? Mostly questions that I ask are going to be about contributions of the seminal glands, which are here and here, the prostate gland, and the bulbourethral gland, how they contribute to semen, and then I will ask you some questions about sperm production and the changes that sperm undergo until they're ready to fertilize an egg. This is an illustration of the area between the penis and the scrotum and the anus, and just the perineum area. Okay, so the seminal glands, here's what you definitely need to know. For the seminal glands produce a viscous, that means thick, alkaline, that means basic, seminal fluid. Because the semen once the semen enters into the female vagina, it's a very acidic environment, which is bad for the sperm. So the semen is alkaline so that it can kind of counteract the acidic environment of the vagina and keep the sperm from dying. The composition of the seminal gland component is fructose, which is sugar, citric acid, enzyme called vesiculase, and prostaglandins, which are like antihistamines. The yellow pigment fluoresces with UV light. That doesn't really matter. And the composition of the seminal glands takes up 70% of the volume of the semen. Okay, so, and the fructose, by the way, is to give energy to the sperm. It's their source of energy. They have a lot of mitochondria in the tail so that they can swim, and they need the fructose to supply them with energy. The prostate secretes a milky, slightly acid fluid. It contains citrate or citric acid, enzymes, and PSA, which is an antigen, prostate-specific antigen. This fluid plays a role in activating the sperm, and it makes up 1/3 of the volume of semen. Now, the last component of the semen comes from the bulbourethral glands. It is a thick, clear mucus, and it lubricates the gland's penis, neutralizes traces of acidic urine in the urethra. That's the main purpose. So make sure you know the composition of the semen from in addition to sperm, there is the part that comes from the seminal glands, and then the prostate, and then the bulbourethral glands. Just make sure you know. On the clinical note, in fact, this is where we'll start in the next recording, is on this clinical note, benign prostatic hyperplasia.